Hello, everyone. I'm pleased to welcome you to today's webinar about LGBTQ plus health. We're recording this so that we can share this during Pride Month, and we're very happy to welcome Dr. Ning Hsieh with us to be our guest expert in today's webinar. My name's Carrie Schreier. I'll be serving as your host. I've been here with Extension now about 18 years, and I'm really looking forward to delving more into this topic. Dr. Ning, would you like to go ahead and introduce yourself, and then we can get going?
Yeah, sure. First, thank you for inviting me to this interview. I am an associate professor of sociology at Michigan State University. I teach and research about health and healthcare inequity, social determinants of health, and population processes using both national and state level surveys and in-depth interviews. My research goal is to understand health and social experiences of sexual and gender minority, racial ethnic minority, and aging populations. And I have lived in Michigan for almost 8 years now.
Great. I hope you're enjoying it here in Michigan. We're heading into the best time of the year here. I love summer in Michigan.
Definitely.
Why don't we start by asking you if you could tell a little bit more about what things you've done to learn more about healthcare experiences among LGBTQ plus individuals, and why you chose to pursue this path with your research.
Yeah, sure. So my earlier studies, LGBTQ plus people did not focus on their healthcare experiences. I started with studying health disadvantages faced by this population. And in general, I found that LGBTQ plus people have poor health outcomes compared to their straight or cisgender peers in a wide range of physical and mental health outcomes, for example, cardiovascular disease, depression, and cognitive functioning. So I began to explore different reasons for the health disparities, including social, economic, cultural, and behavioral factors. And that's how I started to find that poor access to healthcare and underutilization of healthcare services are some of the major factors that may explain LGBTQ plus people's poor health. LGBTQ people tend to have more health problems compared to straight cisgender people because they're more likely to skip or delay needed healthcare for fear of discrimination and mistreatment by health providers or healthcare systems. Of course, LGBTQ plus community is not homogeneous at all, and healthcare and health experiences really vary by sexual, gender, racial, ethnic, and other identification. For example, bisexual people tend to experience more healthcare challenges than gay and lesbian people. And LGBTQ people of color also tend to have more difficulties than white LGBTQ people. So overall, the goal of my research is just to understand not only healthcare inequity faced by LGBTQ plus population in general, but also inequity within this population.
Great, that's so interesting. I know you've already started to share with us a little bit, but could you talk more about some of the key things that you've discovered while you've been doing your research, particularly around healthcare experiences?
Mm-hmm. Yeah, so my research using national survey data suggested that LGBTQ plus people tend to have poor healthcare experiences than their straight or cisgender peers. For example, they're less likely to have a primary care provider and more likely to use emergency department as their usual source of care. Financial issues and insurance coverage are important, but they can only explain part of the disparity. And this actually suggests that even among LGBTQ plus people who have no concerns about paying for healthcare, they still struggle with healthcare access, and they still use healthcare less often than straight and cisgender people. Some major issues include difficulty finding gender or sexuality affirming providers, anticipating and experiencing prejudice and discrimination in healthcare settings. So my studies also have found that even though LGBTQ plus people in general have poor healthcare experiences than straight cisgender people, this inequality also depends on gender, sexuality, and race ethnicity. For example, sexual minority women, particularly bisexual women, are less likely to be treated with respect by providers and are less satisfied with the care they received compared to straight women. But this disparity is less noticeable between sexual minority men and straight men. So there's definitely a lot of variation within this community. Yeah, so that's some of the major things I found in my studies.
That's interesting. Some of your answers, I can see why that would logically be, but it's also interesting to me, for instance, that bisexual women would be more dissatisfied with their care than perhaps some other people. It sounds like you're saying our next question is about actually going to the doctor and getting preventative care like vaccinations, regular health care. It sounds like you're saying that in general, we see the LGBTQ plus population is less likely to go to the doctor to have that sort of preventative care.
Yeah, definitely. Generally, yes, they're less likely to have a primary care provider or regular place for healthcare than straight or cisgender people, and definitely more likely to delay or skip needed healthcare. And if we look at the differences more specifically about which groups in the LGBTQ plus community being more vulnerable, so just take flu shot as an example. So the inequity really varies by not just by sexual orientation and gender, but also race ethnicity. In my study, I found that Black bisexual women are one of the most disadvantaged groups. Only about 23% of them had a flu shot in the past year. And in contrast, white gay men are one of the most advantaged groups, with about 56% of them having a flu shot in the past year, which is actually higher than white straight men and white straight women. So these disparities can be partially explained by different access to financial and health resources, and may be partially rooted in institutional racism and mistrust of medical systems among Black Americans. It's not that all LGBTQ plus people have poor healthcare access or use health services less often. Some groups do worse and some do better. So I think it's important to consider how factors beyond sexuality and gender, such as socioeconomic status and race, may jointly influence healthcare experiences. To people who also identify as Black, Native, or Hispanic, or who have lower income, tend to struggle more in healthcare.
That's a very good segue to my next question here about what barriers being in place for the LGBTQ plus population to seek medical attention or to get that medical care. Can you talk a little bit more about those barriers that might be in place for certain individuals?
Yeah, definitely. So one barrier is definitely economic inequity. Compared to straight or cisgender people, at least some LGBTQ plus groups, including trans and non-binary people, have more financial difficulty accessing needed healthcare because of higher unemployment rates, higher poverty rates, resulting from obviously labor market discrimination. And also we know that gender affirming care can be quite expensive, and its accessibility depends on state policies and insurance coverage. And another major issue is medical professionals' lack of training, knowledge, and sensitivity about LGBTQ plus people. Quite a few studies have shown that many sexual and gender minority patients experience ignorance, disrespect, and discrimination when interacting with health professionals. Examples include some providers persistently misgender patients, and others dismiss or ignore patients' health needs, in part because they feel uncomfortable with diverse gender and sexuality. Depending on provider attitudes, LGBTQ plus people may conceal their sexual or gender identity and relevant health information in healthcare encounters because they just fear being judged or mistreated by providers. And these negative experiences often discourage LGBTQ plus people from seeking further healthcare because they anticipate bad experience can happen again. And not very surprisingly, there's difference between urban and rural areas. It is easier to find culturally sensitive providers or affirming providers and other health resources for LGBTQ plus people in urban areas than rural areas.
For many of our families in rural communities, accessing any primary health care can be a challenge. So I'm adding in the extra layer of trying to find a provider who is going to be affirming of your identity is also such a challenge and a barrier for people. I imagine that's got to be quite difficult. Could you talk a little bit more about what you think could be done to encourage LGBTQ plus individuals to see their doctor more regularly, to get those regular vaccinations? What can we do to reduce those health disparities?
Yeah, tricky. A lot of issues to talk about, but I'll just point out a few. So I think some fundamental changes in the medical system are definitely needed to encourage healthcare use among LGBTQ plus people. For example, medical education needs to incorporate more training on diverse sexuality and gender. We know that on average, medical students are exposed to only 2 to 5 hours of training on LGBTQ related topics throughout their medical education. And most medical education continues to teach heteronormative and cisnormative practices. In order to encourage healthcare use, we should improve patients' access to healthcare that is actually affirming to their gender and sexuality, right? And to make that happen, we need more inclusive curriculum in medical school for future health providers and probably also training on the job for current providers. I also think that community support can encourage healthcare seeking too. Some community organizations have created and maintained a list of affirming providers in their local area to help LGBTQ plus community members find appropriate healthcare. This could definitely save time and energy of searching for health providers and reduce the unnecessary harmful interaction with providers who are not ready to treat LGBTQ plus patients. And also community organizations can also help disseminate preventive care information. For example, encouraging community members to get a flu shot or cancer screening on a regular basis, in addition to sexual health care like HIV testing, which we often see that community organizations already engage in. And having job security, financial stability, and insurance coverage is definitely super important for healthcare use. So I believe that addressing discrimination in the workplace and financial issues among some LGBTQ plus people will also encourage them to use health services. And for that, we need workplace policies and state national laws to prevent discrimination.
Like some very high level issues. I had no idea that there was so little training provided to medical care providers throughout their whole medical journey. To only receive a few hours of training definitely seems like an oversight. That's unfortunate. Could you talk a little bit about how I could speak, or how we as individuals could speak to LGBTQ individuals in our lives who are maybe resistant about seeing the doctor, to encourage them to get in, seek medical care, get those regular vaccines, stay updated, help maintain good health?
Yeah, definitely. So if someone is resistant to seeing a doctor, there must be a reason. We already talked about some of the issues, but typically LGBTQ plus individuals, they delay or skip needed healthcare because they either they cannot afford health services or they have really unpleasant healthcare encounters before. I will try to understand what makes them not want to use healthcare to begin with. And there are many ways to advocate for friends, family members, or a partner's health. For example, you can recommend affirming health providers that you know. You can set out an appointment for them. You can also offer to visit a doctor together, or you can share your own positive healthcare experiences and the benefit of using health services to encourage them. I think in terms of vaccination, it may be easier to encourage people to get vaccinated as long as they are not anti-vaxxers and their health plan covers it. Because usually vaccination is accessible at pharmacies and appointment is not required all the time. I say that emphasizing the health benefit of vaccination or the risk of not getting it may encourage people to use healthcare more.
Well, and I think you had talked about the possibility of offering to go with a friend to the doctor. It's much easier to just walk into CVS and say, hey, let's just go get those flu shots together right now when you know you have somebody with you by your side who's safe and is an ally. I can definitely see that being, I don't even go get vaccines by myself. I don't need an ally to do it with me, but I like having a friend with me.
Yeah.
All right. As we've talked a little bit here about what we can do to help advocate, or what I could do to help advocate as an ally, can you talk a little bit about what LGBTQ plus members could do to advocate for their own health issues? How do you go about finding an affirming, an allied healthcare provider? What do they do when they aren't getting the care that they would prefer to have, if I can talk, that they prefer to have from their provider?
Yeah, so it's definitely more challenging for LGBTQ plus people to advocate for their own health than cisgender straight people, because there's just a lack of providers who have adequate knowledge and sensitivity about non-normative gender and sexuality. And for those who live in a state with hostile policy environment where, for example, gender affirming care and DEI-related education and other programs are banned, the situation is probably worse. But LGBTQ people are resilient and many continue to take care of and advocate for their own health. It is critical to find affirming health providers. And I say that it may take some time to find the right one. So reaching out to personal networks and community organizations for recommendations for affirming providers, doing some research online on some of the common ways for self-advocacy. Telehealth may be a good option for certain type of care, such as mental health care. And it has become more common since the pandemic started. In my own research, many LGBTQ plus participants actually indicated that they prefer using telehealth, not just because it saves travel time, but also because it can avoid uncomfortable interaction with front desk staff who may be judgmental about their gender expression or identity. Sometimes,
And even that about that, the doctor themselves may be affirming,
yeah,
but that doesn't necessarily mean that every person working in that office is.
definitely. And yeah, so there are different people working in the clinic. Some may be LGBTQ friendly, others may not. So it's hard to really control or navigate that situation. So even if you find a affirming doctor, it doesn't mean that you will walk into a space that is completely affirming. And sometimes provider would expect their LGBTQ plus patients to educate them about sexual and gender identities and related health issues. It can be frustrating and exhausting for patients when it happens constantly. So I think it's important for both patients and providers to know that it's not patients' responsibility to educate providers. They're there to get treatment, right? Providers need to self-educate and seek out information or knowledge on their own time. And good providers will do research and get training to help their patients rather than expecting patients to educate them. And if patients not feel like they are getting the care they need, I would say that communicate that concern with the provider if they feel safe to do so. If the provider is still not listening and dismiss their needs, it's just time to switch to another provider. Unfortunately, you have to maybe start over and ask around who might be better. But yeah, but it's good for health to change provider.
Yeah, to find that provider who's going to be able to be an advocate for your health and wellness. Yeah, definitely. Are there any other items that you would recommend that LGBTQ plus individuals keep in mind when they're talking to their providers?
Yeah, kind of similar to what I have talked about. I think LGBTQ people, they should pay attention to how their providers listen to their concerns and respect their understanding of their own body. They should also pay attention to whether providers are willing to find different treatment or healing options to accommodate their health needs. It's also good to notice if providers are open to learning things that are unfamiliar to them and use personal time to self-educate or research for patients. So basically, just different ways to check if the provider cares about them. I would suggest the same thing for non-LGBTQ people. It's basically to assess whether your provider is qualified for treating you.
I was actually just going to add, that's such great advice for all of us to think about when we're selecting primary care providers, is to make sure that you're choosing somebody whose interest and background and education aligns with your needs as a person. Yeah. Great. Would you say, as you're looking at your research, would you say that the barriers that LGBTQ plus individuals have for healthcare have changed over the years?
Yeah, I believe that the accessibility and the quality of healthcare is slowly improving for LGBTQ populations over time. If we think about 3-4 decades ago, there has been progress, even though we may not feel the progress has been fast enough as we hope. And even though lately we have seen so many anti-trans bills that ban gender-affirming care in conservative states. But for example, there have been positive changes that gradually improve healthcare experience among LGBTQ people. Some studies have looked at the introduction of Affordable Care Act and the legalization of same-sex marriage, and found out that those policy changes have helped closing the gap in uninsurance rates between sexual minority and straight people. There is also a lot more awareness of and discussion about the need for more culturally affirming providers now compared to even just a decade ago. But of course, how soon this awareness can be translated into reform in medical education and healthcare systems is still uncertain. We have also seen some progress in clinical practices, including adding diverse gender markers or sexual identity labels into the intake form. And some providers have been making efforts to advocate for their LGBTQ plus patients, including updating their knowledge about gender and sexuality. Even though the progress is slow, I think that I feel cautiously optimistic that we will continue to make progress in the future.
Yeah, it's amazing to look at some of those hurdles we have overcome in the last decade or just a little bit longer. I was actually just talking with my oldest daughter about the day she remembers the day that gay marriage became legal, and my younger children didn't remember that. And so it was an interesting conversation for them to think really about how quickly we're seeing cultural normatives change in our community, and we really can watch that. It's happened quite clearly in our lifetimes.
Mm-hmm.
Great. As we're wrapping up here, do you have any other general advice about accessing healthcare that you'd like to give to LGBTQ plus individuals and their loved ones?
Sure. So based on my research and observation of my own social networks, I'd say that although it's not easy for LGBTQ plus people to access healthcare and navigate the healthcare system, it's worth taking extra time and patience to take care of our health. It makes a difference when we lean on one another, allies, and community to find out better healthcare resources. We know that historically, LGBTQ plus people fought the HIV/AIDS epidemic through community building, right? And some recent studies also suggest that community and personal networks continue to support LGBTQ plus people during the recent COVID pandemic. I also suggest anybody who has the capacity to involve in healthcare or social justice advocacy, because that's how we can actually make change, can change the policy environment that eventually will impact the health of LGBTQ populations from the local to the national level. It can be as small as voting for political candidates who support healthcare access as a basic human right, and candidates who advocate for increasing healthcare funding for those who have poor access. Yeah, so we just need to keep pushing for better healthcare access, whether you are LGBTQ or not.
Are there any other information you'd like to share that we didn't get to?
I don't think so, unless you have
No?
additional questions.
I don't have any additional questions. Thank you very much. I
Thank
appreciate
you.
your time.